Well, good afternoon, everyone. Thank you for joining this unscheduled briefing. I'm joined today by Dr. Heather Morrison, of course. As well, we have Dr. Michael Gardam on the line. Questions that the media may have regarding the Queen Elizabeth Hospital operations, given the news that we've had over the weekend. I would like to say also that we will try to be as open and forthright as possible, but also ask for the continued privacy and respect for those who are facing health issues. This is a small province, and we need to remember that we have a duty to ensure that our patients are protected both from a health perspective as well as with their personal privacy. I'd also just like to begin on behalf of all Islanders and sending my thoughts and prayers to our provincial neighbours in Nova Scotia as they mark the solemn anniversary of the Portapique tragedy that claimed 22 lives of innocent Nova Scotians. And today I wear the Nova Scotia tartan tie in their honour and memory. While we can't gather in person to help our neighbours mourn this difficult time, I want all Nova Scotians to know that Islanders have been thinking of them and that you are in our hearts. Recognizing that the past few days have brought with them some difficult news for Islanders, and further recognizing that we are in the midst nationally of a third wave of COVID-19, in which case infections are growing at a faster rate than at any other time in the past 13 months. We wanted to provide an update on our current situation, as well as to outline our efforts to do everything we can to continue to limit the spread of the virus in our province. Also wanted to send out my best wishes and thoughts and prayers to the two individuals who are currently hospitalized, as well as their families and friends during this most difficult and worrisome time. And I ask that all Islanders keep these individuals in your thoughts and prayers. I also wanted to recognize the brave and courageous health staff providing first-class care to those individuals and so many others. On behalf of Islanders, I offer my thanks and appreciation. We have been planning and preparing for this situation, and though we hope to never have to execute on that planning, we were ready, we are ready, and we've executed those plans effectively. We have tremendous healthcare professionals who go above and beyond the call of duty in the interest of keeping all Islanders and Island patients safe. And I know that all Prince Edward Islanders share my gratitude and thanks. The news of the past few days, though shocking to some, is indicative of what is happening across the country, and further reality that though we have been doing very, very well in this province, that we are not totally insulated from the COVID-19 virus or its variants. Yes, it has been a long haul. Yes, we are tired of the grind, but we have not been released from COVID's tight grip yet, and much more work remains. In a few minutes, along with our current, most recent COVID update, Dr. Morrison will outline some increased safety measures we immediately will implement to help us work through the next few weeks. We intend for the measures to be short-term and temporary, but as always, we will let the best epidemiology and science guide us in our decisions. Those measures will be directed towards our borders. Though we have some of the strictest borders in the country, we will try to tighten them up a little bit more. And by doing so, it is our hope to limit the importation of the virus to our province, therefore allowing us to maintain the standards of life that we have been enjoying in this province, which has been the envy of the country. As of today, we do not intend to restrict measures within the province, and we hope for that to continue in the days ahead. It is never our desire to be restrictive, but these efforts are needed to be done because we have to undertake quickly what is a worrisome trend that we are seeing across the country. We have done well as a province by moving quickly, by going hard, and that is the approach we will continue to take. And just before I turn it over to Dr. Morrison, I want to address the requests for emergency health assistance that we've been asked by Premier Doug Ford of Ontario and Prime Minister Trudeau. We will try to do what we can. Later today, we should know better to what extent, if any, what that assistance could look like. Both Premier Ford and Prime Minister Trudeau know that our health human resources in Prince Edward Island aren't in overabundance. Both expect and appreciate that our first priority is to do everything that we can to protect the health and safety of Islanders. But all of that said, we will try to do our part. What we have been dealing with for these past 13 months is the most difficult situation we have faced as a country since the Second World War. Our lives have been turned upside down, and no Canadian from any corner of this country has been spared. It would be very easy, given all that we've been through and all that we continue to face, to revert to a protectionist instinct, to develop an us versus them mentality. But that isn't who we are as Prince Edward Islanders. I'm proud of how we've largely fought off that me first and only me mentality. Throughout this pandemic, we have remained committed to our island values. And to me, that is as much the story of COVID as anything else. So in the face of great difficulty and uncertainty for our family, our friends, our neighbors, our fellow Canadians in Ontario, we have been asked to see if we can do a little bit to help, and we are trying very hard to respond to that request. Just like I know Canadians from all parts of the country would do the same if it were Prince Edward Island making the request of them. We look out for each other. That's what we do as Canadians. And it's more important now than ever before that we remember that we revert to the instincts of kindness, of generosity, and that we allow our humanity to shine through because it is needed so badly. To the extent that we are able to help in this difficult time, we do so in knowing that our efforts may be small in numbers, but they will be large in terms of effort and heart. And we will do so in knowing that every little bit, even a little bit, will be a help. So with that, I will turn it over to Dr. Morrison for a COVID update, and then we will take questions from the media.
Thank you, Premier. Good afternoon. Today, all our hearts are with our friends and neighbors in Nova Scotia on the one-year anniversary of the senseless mass shooting that took the lives of 22 innocent people and injured others. I know my thoughts and prayers are with everyone, and so many of us in PEI, our thoughts and prayers are with our sister province, especially the families and friends of those who were killed. Thank you for attending this unscheduled COVID-19 briefing. Today, as the Premier mentioned, will be an update on COVID-19 in PEI in Canada, as well as to discuss additional travel, testing, and enforcement measures that will be implemented in our province. I know Marion and I will be back to give our normal COVID update, our weekly update later this week. In PEI, there are 3 new cases of COVID-19 to report. One individual in their 30s traveled to PEI from outside Atlantic Canada and is a close contact of a previously announced case. This person has been self-isolating since arriving in PEI and will be followed daily by public health. 2 cases that we just learned about this morning are both in their 20s. They traveled to PEI from outside of Atlantic Canada and are self-isolating. Contact tracing is underway. Over the weekend, we reported 3 other cases, one in their 50s, one in their 30s, and a child under the age of 10. We've also been advised over the weekend by the National Microbiology Lab and our provincial lab that 4 out of 4, 100% of our recent cases that were sent off to the lab have been confirmed as a variant, specifically the B117, originally identified in the United Kingdom. Given the increase in COVID-19 variant cases elsewhere in Canada and in the region, it is not surprising to learn that B117 is becoming increasingly prevalent in PEI. We know the variants are more transmissible and can result in more severe illness. During the past week, we recorded our first 2 hospitalizations related to COVID-19. Both individuals are being cared for at the Queen Elizabeth Hospital, with one requiring intensive care. The current acceleration of COVID-19 in Canada and the concerning rise in the proportion of variants of concern is not a good situation. I know we are now in the 2nd year of a global pandemic, and COVID-19 continues to represent an unprecedented threat to the health, social, and economic well-being of our country and our province. We are aware of the surge in new cases in many provinces, with each day seeing more cases than the day before. In the past week, cases in Canada are up 21%, with an average of almost 9,000 new cases per day. Put simply, the numbers are going in the wrong direction. Canada has reported almost 52,000 cases of variants of concern. Most are the B117 variant of concern. In terms of the average number of daily cases, Canada has surpassed the peak that we experienced in the second wave. In Canada, during the past week, hospitalizations are up 34%, ICU admissions are up 22%, and deaths are up 33%. In particular, healthcare providers and systems in Ontario are under strain as a result of a crushing third wave of COVID-19. There is significant demand for hospital and intensive care in that province, with over 4,000 people in hospital related to COVID-19. Adults are being admitted to pediatric hospitals, which is a first in that province. Travel outside of PEI continues to be the biggest risk factor for COVID-19 and PEI. Specifically, in the past week, we've had 8 travel-related cases. This is higher than we experienced in the post-holiday period in early January. As I mentioned, at least 4 of our recent travel-related cases are B117 variant of concern, and we know B117 is associated with a 63% increased risk of hospitalization, a 103% increased risk of ICU admission, and a 56% increased risk of dying due to COVID-19. While I'm concerned with the number of variants of concern and the fact that all our recent cases are related to travel and that we have our first 2 hospitalizations, I'm also very worried about what is happening in the rest of Canada. I've stated publicly on numerous occasions that our COVID-19 game plan has been simple: to limit the risk of importation of the virus into our province, and when we do get cases, to work hard to contain the transmission and keep people in PEI safe. It is becoming increasingly clear that now is the time to revisit our game plan. We need to be proactive and take additional steps to reduce the risk of importation of COVID-19 into our province at this time. It is my recommendation that Islanders limit interprovincial travel unless it is for essential purposes. I met with the Premier this morning and recommended that, effective immediately, we take steps to limit travel into our province, specifically travel by non-residents from outside of Atlantic Canada. These measures are intended to further reduce the risk of importation of COVID-19 and lower the likelihood that people come here and could get sick with COVID-19, putting additional strain on our healthcare resources. These measures will give us more time to immunize more Islanders against COVID-19. While we've had strict border measures in place, including travel streams and pre-approval travel for the past 13 months, we will be taking steps to tighten these measures in response to the worsening COVID-19 situation in Canada. Effective immediately, and for at least the next 4 weeks, until May 17th, PEI is pausing for some non-PEI resident travel to the province from outside of Atlantic Canada. The following measures will be in place. Seasonal residents from outside Atlantic Canada who plan to come to PEI in the next 4 weeks will be advised to defer their travel until at least May 17th. Individuals affected by this change will receive written notification from Justice and Public Safety. New pre-travel approval applications for seasonal residents outside Atlantic Canada will be processed over the next month. However, tentative dates for arrival will be after May the 17th. The Family Connection stream for seasonal residents is also paused. Over the next 4 weeks, applications for pre-travel approval for permanent relocation to PEI related to work or school will continue to be processed. But anyone from outside Atlantic Canada who has pre-approved travel related to permanent relocation to PEI between now and May 17th for work or school purposes will be required to have a proof of a negative pre-departure COVID-19 test within 72 hours of arriving on PEI. After arriving in our province, these individuals will be required to isolate for 14 days and test on days 0 to 1, 4 to 6, and 9 to 11. Rotational workers and truck drivers who work outside of Atlantic Canada will be required to self-isolate until they receive their first negative test after arriving in PEI, regardless of their vaccination status. These individuals who are registered with our office are reminded to follow the testing regimen. Workers coming to PEI from outside of Atlantic Canada will continue to need pre-travel approval. In addition, they will be required to have proof of a negative pre-departure COVID-19 test within 72 hours of arriving in PEI and have a negative test upon arrival prior to entering their place of work and agree to be tested every second day while in the province for the first 14 days. Travel to PEI for compassionate reasons, including those from outside Atlantic Canada, will continue to be processed and approved on an individual basis. In addition, family visits that are required to provide necessary support to island residents will continue to be considered under the Family Connections travel stream. Everyone arriving in PEI from outside of Atlantic Canada and is required to self-isolate for 14 days, and if they're not already being tested, will be required to do so on days 0 to 1, 4 to 6, and 9 to 11. There are no changes in the requirements for residents of Atlantic Canada to travel to PEI for work or school. Travel to and from PEI for non-essential purposes is not recommended at this time. We will be working with Health PEI to plan for increased testing capacity at the points of entry, especially Borden and the Charlottetown Airport, and we'll have more information to share later in the week. In partnership with our colleagues and with Justice and Public Safety, we will be stepping up our overall enforcement measures. I know these measures are not what people want to hear. We would much rather hear about what we can do to open up our province for the spring and to plan and welcome and visit with family and friends off island. We continue to bear the burden of measures to protect ourselves and others against COVID-19. Now more than ever, we need to tailor our response to limit importation and minimize the burden of illness in PEI. We need to maintain a high degree of caution until we have more people vaccinated. We need to buy more time. And these measures are temporary for at least the next 4 weeks. They will not be forever. So as we continue our unpredictable journey with COVID-19, let us continue to be patient and let us continue to be kind. Thank you.
Well, thank you very much, Dr. Morrison. Now we will turn it over to some questions from our friends in the media.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr. Morrison. Tout d'abord, avant de poser ma première question, est-ce que vous pouvez essayer de traduire de manière un peu plus générale ce que vous venez d'expliquer, notamment concernant les mesures aux frontières, s'il vous plaît, en français?
Bonjour. OK, je vais quand même essayer ce que j'ai dit en anglais. Alors, je m'excuse juste un instant. Vraiment, à cause du grand nombre de cas partout au pays et le grand nombre de personnes à l'hôpital, on essaie de mettre les mesures en place pour limiter l'importation de COVID-19 à notre province. Alors, on met ces mesures en place pour 4 semaines jusqu'à le 17 mai. C'est comme toujours, on va évaluer tout le temps. Et ces mesures sont en place tout de suite. Et c'est vraiment une pause pour les personnes qui ne sont pas résidents à l'île du Prince-Édouard quand ils voyagent ici à l'île du Prince-Édouard. Et c'est les personnes qui voyagent ici hors de la région atlantique. Alors, les résidents saisonniers qui viennent hors de la région atlantique, on veut qu'ils ils n'arrivent pas ici avant le 17 mai. Et ils vont continuer de faire les applications avec le Bureau de Justice and Public Safety, mais ils ne vont pas avoir vraiment la permission d'arriver ici avant le 17 mai. Et puis, mais s'il y a des personnes qui vont déménager ici à l'île du Prince-Édouard pour travail ou comme étudiants, ils vont continuer d'être process. On va faire les applications. Mais avant qu'ils arrivent ici, il doit avoir un test qui est négatif en avance d'arriver ici. Et puis, quand ils arrivent ici, ils doivent isoler pendant 14 jours et avoir 3 tests. Et on veut aussi que les camionneurs et les personnes qui travaillent en rotation, les rotational workers, ont un test négatif, isolent au moins en attendant leur premier test négatif. Aussi, les travailleurs qui viennent ici pour faire un emploi ici, qui ne sont pas résidents de l'île du Prince-Édouard, vont aussi présenter un test négatif pendant 72 heures avant d'arriver ici. Et puis, quand ils sont ici, ils doivent attendre pour leur premier test négatif et être testés chaque 2 jours quand ils travaillent ici. Mais si vous travaillez ici pour les raisons de compassion, pour supporter les familles, ça va continuer comme c'est maintenant. Je pense que c'est, et pour les résidents de la région atlantique, si vous voyagez ici pour travail ou comme étudiant, c'est les mêmes sortes, ça ne va pas changer. Et puis, on vraiment dit à tout le monde, si vous ne devez pas voyager entre provinces, ce n'est pas recommandé à ce moment.
Merci pour cette traduction en français, Dr Morrison. Ma première question va être pourquoi vous vous sentez dans l'obligation aujourd'hui de mettre en place ces mesures exceptionnelles et plus restrictives à nos frontières?
Je pense que peut-être j'ai expliqué en anglais, on voit plus de cas qui arrivent ici. On a plus de les cas de variants et on veut vraiment, quand on veut protéger les insulaires, on veut avoir plus de temps pour qu'on peut vacciner plus de monde ici et pour leur aider à leur protéger. C'est pour toutes ces raisons.
Mon follow-up, Dr Morrison, va être parlez-nous de la situation avec les 2 personnes qui sont hospitalisées. Comment vont-elles? Est-ce qu'elles sont atteintes du variant et comment ça se passe à l'hôpital Queen Elizabeth en ce moment?
Alors, je vais dire, on ne sait pas encore les résultats, si c'est les cas à l'hôpital sont variants. Et puis, ils sont, on a déjà dit qu'ils sont en soins intensifs, mais ils sont stables, mais on ne donne vraiment pas plus de détails à cause de la confidentialité des patients.
Merci beaucoup.
Okay. Merci.
Allison Jenkins, The Guardian.
Yes, hello. Thank you for this unscheduled briefing. Just wondering about the hospital operations at this time. Perhaps a question for Dr. Michael there. Are the people in hospital in a dedicated unit? Is there still a special set-aside space for the COVID people?
It's been identified that one particular ward at QEH, as well as the ICU, would be places that people would be housed. So they've gone to the right parts of the hospital. That doesn't mean those parts of the hospital are empty, however. They continue to have other patients as well, but these people are in isolation rooms.
Okay, thank you. And I think for Dr. Morrison, is there any indication that the people who are sick now were part of, were they essential workers, were they rotational workers, or related to those people? Or is it a surge from the Easter holidays and perhaps travel that happened around Easter? Is this the Easter surge that we were watching for?
Allison, what I can say is that all the cases that are in hospital or recently are all related to travel outside the province, but. I don't think certainly the one of the people in the hospital is less than 10 years old, so obviously not a worker. But I think at this point in time, that's really all we would say about the individuals who are in hospital, it's related to travel outside the Atlantic area.
Thanks. Just looking to see if they were, at risk because of travel or people who had been traveling as essential workers. But I understand the need for privacy, so thank you.
Okay.
Suzette Belleville, CTV.
Hello. My question has to do with reallocating resources to Ontario to help with their third wave. I know Premier King mentioned that more information would be released later today, but I know a lot of people are wondering what kind of resources you'll be looking at. I know in a statement released by Premier King Saturday night, it said there were talks with the University of Prince Edward Island, with Holland College. Just wondering how that's going and if there's any other information you can provide us with on sending resources to Ontario. Thank you.
Yeah, no, thanks for the question. We will have a little bit more information from the department later today, but essentially we just committed to try to scour the province, to find as many available bodies as possible. I don't think there's an urgent need in Ontario right now for nursing students, for example, but that could change in the days ahead. So we just wanted to generate a list to see who could be there. But there are some professionals within our healthcare system who have expressed some interest to helping out, and we're trying to determine first and foremost, can we spare them from here, what field of practice they are in? And then we will be in a better position later today to give a more definitive number of the effort. But we want to do our part, as I've been saying. We feel it's part of our duty. We expect other provinces would do the same if we were to make the call. Lord forbid that we have to do that. We hope we don't have to, but that's part of being in the federation and part of being part of this great country, is we try to help each other. So we will see what we can do. We know it will be minimal, but if we can help at all, and are happy to be asked, and hope we can respond.
Thank you so much for that, Premier. I'll just end by asking, you were talking about scouring the province to see if there was anyone interested. Are you looking at sending any vaccines at all, or is that kind of off the table for now, and you're just looking at perhaps sending people or healthcare professionals if you have to?
Yeah, we haven't been asked right now. I know there was a reference from the CMA in that regard, but neither Premier Ford nor Prime Minister Trudeau inquired about that. I think we all recognize, as we've been saying, that we all need to find our way through this, of course. And look, we have to be open to everything that's taking place in these difficult times. But we feel, in conversation with Dr. Morrison and so many others, that really one of the best things that we can do is continue to get our islanders vaccinated as quickly as possible, and that's our best way through all of this. So as of today, we have not been asked in that regard.
Perfect. Thank you so much. Appreciate it.
So much.
Eloise Rodriguez, Radio-Canada.
Oui, ça serait un peu la même question en français, mais pour la docteure Morrison, j'aimerais savoir qu'est-ce que vous recommandez selon la situation actuelle à l'île du Prince-Édouard. Est-ce que la province est dans la situation où elle peut se permettre d'envoyer, par exemple, des travailleurs, des professionnels de la santé ou même des vaccins C'est quoi vos recommandations?
Bonjour. C'est vraiment comme le Premier ministre a dit en anglais que on veut, on veut quand même regarder. On n'a pas, je pense pas, un grand nombre de personnes qui peuvent aller ou on peut trouver à aller pour supporter, mais quand même, on va faire la question aux gens. Je pense on veut pas que on veut rien faire que pour mettre notre programme de vaccination à risque. On veut rien faire pour mettre notre système de faire les tests de COVID-19 ou la laboratoire à risque. On veut avoir assez de personnes pour supporter le système de santé ici, à l'île du Prince-Édouard. Mais on sait qu'on a les autres provinces qui ont tellement besoin de l'aide. Alors, c'est vraiment si on a assez de capacité hors de notre propre système ici pour aider avec vraiment les supports de personnes qui ont besoin. Mais seulement si on peut faire ça sans mettre à risque les insulaires ici à l'île du Prince-Édouard.
Merci, Dr. Morrison. And my other question is maybe for the Premier. I'm wondering if you guys are considering lowering the age for AstraZeneca like it's been done in other provinces today.
Perhaps Dr. Morrison can take that.
Hi, I'll just make a mention. I mean, I think Ontario and Alberta have reduced the age of AstraZeneca really on risk-benefit analysis that they're looking at in relation to the number of cases and the risk of COVID versus risks of side effects or and what they're looking at from that point of view. So that conversation is also happening at a national level right across the country, and I know I participated in some of those conversations until late last evening as well. So it will be really, I think, some of the age restrictions on AstraZeneca will likely be related to the impact of the disease in different areas. So we'll continue to look at that and evaluate it. I know we'll be talking about it with my Atlantic counterparts as well later this afternoon.
Est-ce que je peux vous avoir en français sur ça, s'il vous plaît?
OK, si je peux souvenir, c'est vraiment, on va discuter comme dans la région, qu'est-ce qu'on va faire à propos de AstraZeneca et l'âge qui nous donne, je pense que partout dans la région atlantique, on donne AstraZeneca les gens 55 et plus à ce moment. On sait que Ontario et Alberta ont baissé l'âge pour AstraZeneca, mais c'est vraiment à cause du quand ils regardent les risques versus risques et puis les bénéfices de faire AstraZeneca. Alors, je pense que ça va dépendre vraiment aux régions dans les pays. Qu'est-ce qu'on va faire avec AstraZeneca avec l'âge? Mais on est parti de les discussions aux régions nationales à propos de AstraZeneca.
Merci.
OK, merci.
Carrie Campbell, CBC.
Hi, thank you. Dr. Morrison, first of all, I guess from a public health point of view, I mean, every time someone comes into the province, I guess that brings a risk that they could bring the virus in with them. I'm just wondering if you can provide any context in terms of how many people is that on, if it's on a monthly basis or whatever, how many people coming into the province, and how would today's restrictions change that number? How many people would be affected by the measures that you mentioned today? And then if the Premier wanted to provide any insight as to whether any other restrictions were discussed, things like delaying the arrival of temporary foreign workers or anything like that. I'm just curious kind of what might have been on the table.
So, Carrie, I actually carry those numbers with me almost every single briefing. On all my regular briefings, I know how many people are coming into the province. I don't have them here today, but we can provide them after the briefing to you. We know that the bulk of our travel is in Atlantic Canada. In general, in terms of our streams of travel, certainly the majority of it is still within Atlantic Canada. I think we will have probably some reduction in of course, the seasonals and the families of seasonals, and some families in the family stream, if they're just coming for vacation here in the next month, those numbers would be reduced. We have some sense when we look at how many applications have been done over the last month, what that might mean also for the month ahead. But remembering that compassionate reasons and those family supports that people really need to come for support will continue. I think we may have a reduction in some numbers for workers coming because we need to make sure that they test negative prior to arrival. So that may be some slight reduction there, just making sure that they are able to present a negative test at our points of entry. So, as the Premier pointed out, we have very good border measures in place, and we've put them in place 13 months ago, and now there are many parts of the country who are just instituting them over a year later. So we've done this for a long time, but we wanted to look at, is there any way we can try to limit the importation of this virus, which is likely a variant, in these next few weeks when the cases are soaring in other parts of the country. So I think the numbers may not be huge, but we will certainly, I think, because right now people can only come in certain travels, but I think if we can limit how many people come here with COVID, we limit the risk of spread of COVID, and we risk people being sick here with COVID as well.
Okay, I don't know if Premier was going to jump in. I don't want to lose a question here, so I'll just go in with question 2 then. I just wonder, Dr. Morrison and the Premier, if you're still there and you want to weigh in on this one, just kind of a bigger picture view, and I think today's briefing is kind of the long answer to this question, but what we're seeing with the variant, you mentioned the statistics around the increase in transmissibility, the severity of the hospitalizations, et cetera. How this changes things. We see the spread in Ontario and other provinces. We've got our first hospitalizations on PEI. How does this change things? And specifically, I'm thinking about our planning moving forward in hopes of eventually opening things up in this province.
You want to start, and then sure. Well, I'm still here, Carrie. I appreciate you reaching out and verifying that, but I thought Dr. Morrison did such a great job on the first answer that it didn't need any a follow-up for me. Just in terms of kind of where we're at and what it looks like. I mean, it changes so much so fast that, I think obviously 4 weeks ago we felt a lot better about what the spring and summer would look like perhaps than we do now. And as we get more and more people vaccinated and hopefully push back on this third wave, that might change. So we've tried really hard not to be too definitive one way or the other, and we know that's brought with it some challenges, of course, but it's just the reality that we live in. I think one thing that stuck with me is what Dr. Morrison said to me on Friday, that a conversation she had with her senior staff and her team, where one of them said that they were more afraid now than they've been at any time in 13 months. And that carries a lot of weight with me. That means that we need to continue to be very, very vigilant. And although we've fought really, really hard and we've done a great job here, that perhaps for the next 4 or 6 or 8 weeks that we're going to have to fight just a little bit harder. So I think that's what brings us to today, and it's really, really, we want to look at the future with, with open eyes and a hopeful heart, but we're in a difficult time now, and it's hard to look beyond the next couple of days sometimes.
Thank you.
Thank you.
Louise Martin, CBC.
Hi to you both, and good afternoon. I'll start with Dr. Morrison. And respecting the privacy, of course, of the two patients at the QEH, can you give us an update on their condition today and whether either had an underlying medical condition? Were they admitted for COVID-19 or admitted with COVID-19?
Hi, Louise. So I think we are not commenting on anyone's health condition. Certainly with two patients, it's not what we would be discussing. But sometimes, just like at the end of an influenza season, we might look at, a larger number of hospitalizations and say a certain percentage of them have underlying health conditions. That may be something we do at the end of if we have more hospitalizations and have bigger numbers, but not at this point in time. We wouldn't comment on that. And both remain in hospital in the units. The person in intensive care, certainly at the last update I had, was not intubated. But they remain in their units. And Dr. Garnham might have a further update, but certainly no other information that we would be prepared to give out on either one of those patients.
Okay. Thanks so much. And I'm going to turn my attention now to the ever popular subject of the Atlantic bubble. I'm assuming that this has now been popped for 4 weeks. Can you just tell us how these new restrictions impact that May 3rd target, and what is the latest thinking on opening up the borders to regional travel?
Well, thanks, Louise. I think most of what we have identified today for our border measures are aimed at outside of Atlantic Canada. And I think what you look at what some of our sister provinces are doing in Atlantic Canada in terms of measures, they are all designed to keep us safer. So that's a good thing. With all interprovincial travel being discouraged by Dr. Tam at the national level, that's something that we have to take very, very seriously. When we looked at May the 3rd, for an example, we said that we would revisit that in the week leading up to that date to see what's changed or what's on the horizon, and we will do that. So I think our goal just remains trying to work really, really hard and to act quickly to get through this most current wave. And we have maintained our desire to open to the Atlantic region when it is safe to do so. When the epidemiology and science supports that, we will be in a position to do that. And whether that takes a pause beyond May 3rd, we're not able to say right now, but we'll just see how that goes.
Okay, so just to be clear, the bubble's not off the table at this point in time anyway.
Well, it's not our high priority today, of course, as I've been saying throughout the day. This has been a difficult weekend for Prince Edward Island. It's been a difficult weekend for our health staff and not to mention those two individuals who are hospitalized. So we look at a lot of different things in this regard. But Dr. Morrison talks with her colleagues throughout the region, and we will just see how things go. But we have to make sure we're doing everything we can to keep individuals safe and to try to do our best to push COVID back. And if that requires a little bit longer to not have interprovincial travel beyond the essential travel, then that's what we will do.
And I thank you, Premier. And the only thing I'd add, Louise, I mean, when we look out over the last 14 days, we've had more cases in Atlantic Canada than we did in the 14 days leading up to the suspension of the bubble back at the end of November. We also have more active cases in the Atlantic area today than we did the day that we suspended the bubble. So we're going to continue to look at that, as the Premier mentioned, in the days leading up to that bubble. But we really we're trying to protect Islanders. We want the whole region, of course, the Atlantic area, to be the safe, certainly it's the envy of much of the country as a region. And so it's important that we all do that together, and I think we'll see what happens. We've certainly learned every week things can change, but we have a lot, and the Premier alluded to this earlier too. I mean, we're able to do an awful lot of things in PEI that our family and friends in Ontario are not able to do, and we want to make sure we continue to do those things. Our children in school, people going out to eat at restaurants, and participating in activities. And I know that the rest of Atlantic Canada also wants that to happen. So if we can do it together at some point, that would be great. So I think it will be day by day and over the next couple of weeks.
Thanks so much for your time today to both of you. Thank you.
Thank you, Louise. And thank you very much as well, Dr. Gardam and Dr. Morrison. And we will be back in a few days with our regular update. But to all Islanders, stay safe.